So now we're going to go over how to perform the FAST scan. And this is a scan that's used in trauma. It's called a focus assessment using sonography for trauma or in trauma. You're basically looking for free fluid in the abdomen, around the heart, in the chest, as well as looking for pneumothorax of the chest. So we're just going to go over the protocol that I use. So here we're going to use the phased array probe. The patient is going to be in a supine position because it's in a trauma setting, so they're usually lying flat. You're going to put the probe, you're going to assess the right upper quadrant, the left upper quadrant, the pelvis, and then you're going to assess the heart and then the lungs. And we'll go over through it in that order. So the first scan is the right upper quadrant scan. So here is the right upper quadrant scan. Indicator's up towards the head. It's around the 8th to 10th intercostal space in the mid-axillary line. And you're looking for Morrison's pouch, the space between the liver and the kidney, for free fluid. Make sure, in addition, you look towards the edge of the liver because sometimes fluid can track there also. The next scan you're going to do is the left upper quadrant scan. So this is knuckles to the bed, looking for fluid around the spleen. And here we see the spleen. And the fluid doesn't track between the spleen and the kidney usually unless there's rupture of the splenorenal ligament. In addition to looking at fluid around the spleen, you want to look above the diaphragm, looking for any fluid in the chest. And here you see a good mirror artifact sign. There's no fluid there. That's completely normal. And remember to also do this on the right upper quadrant, looking for fluid in the right chest. The next portion is going to be the pelvic scan. Here, you're looking for free fluid above the bladder. So indicator is up towards the head. And you see the bladder here. There's no free fluid above the bladder. Another organ to identify is the prostate in this view. And free fluid, once again, is above the prostate and above the bladder. The next view is going to be the cardiac view, looking for pericardial effusion. And there's two views you can use. You can use either the subxiphoid view. And since this is on the standard mode, the indicator is going to be towards the patient's right side. And you're going to identify the liver and sweep in and look for that heart. And here we see the heart, the four chambers of the heart. And when the patient takes a big breath in, brings it closer, you get a better view, that subxiphoid view, looking for pericardial effusion around the right ventricle or left ventricle, and looking for any collapse of these ventricles, signifying tamponade, specifically right ventricular diastolic collapse or right atrial systolic collapse. Another view you can use, if you can't get a good subxiphoid view, is a peristernal long axis view. And once again, since we're in standard mode, the indicator is going to be towards the patient's left hip. So here, you're going to get a peristernal long axis view. And the main thing you're looking for is pericardial effusion. You're not assessing, you don't have to necessarily assess all the heart function, but look for pericardial effusion and looking for tamponade here. And this looks normal here. You can see the pericardium both anteriorly and posteriorly in this view. And the last portion that you do is looking for pneumothorax, and that's looking for lung sliding. So once again, the indicator is going to be towards the patient's head, second intercostal space, mid-clavicular line, where you would do a needle-thoracostomy basically, and you would decrease your depth. So you see I'm decreasing my depth all the way down here. And here you're looking for lung sliding. So when the patient breathes in, so if you can take a big breath in, you see there's lung sliding on the screen there, and that indicates there's no pneumothorax. If there is no lung sliding, that is highly suggestive of pneumothorax in the setting of trauma. You want to make sure you do both the right side and the left side, looking for lung sliding. And this patient has lung sliding on both the left and right side.